what are we expecting as an outcome. So our expectations from our children should also be at the right level. Like I would say, if I go through the assessment of autism or anybody else, there are few areas even I'm not 100%. But what key thing to remember is being functional in our day-to-day life and being able to kind of live a quality life. So basic functional skills is what we are aiming at. So nobody is 100%. So even with these, it's not that they don't have these emotions or social skills in them. It's just helping them. They have a different way of learning. We need to understand how to help them learn and how to kind of express those things. So it is not that they don't want friends. It's not that they don't feel emotions. It's all in there. We need to, because they're not able to communicate, we don't know. Once we work on these things, things can get better, definitely. Brain is very amazing. So even when you see in older people also, when they have stroke and things, they can still regain functions. So that is where the neuroplasticity comes. But again, why we kind of focus on starting early is, at a younger age, they can absorb more, they can learn more easily. We say in the first 2 to 3 years, there's a lot of connections and brain growth happening at a very fast pace. So when we start intervening, we can pick this up by 1.5 years to 2 years as well. So when we pick this up this early on and support, we see better outcomes. One is the behaviors, rigidity may not have set in yet. So it is easier to work on. We don't have to undo the behaviors before we can start helping the child learn. The other is the brain growth. But the learning doesn't stop with these years. Skills can definitely kind of be still learned, but it happens at a faster pace at a younger age. So that is why we emphasize on early intervention and starting early. And again, when you kind of asked about how does this work, it is all about the brain wiring, where the problem is in autism children. If you see, they still have their strengths in certain things, they do so well, and you wouldn't even have thought this can happen there. So it is a certain areas of brain that the interconnections have not happened properly. So when the brain is growing, connections are happening, if we help them learn. And these connections happen. One thing to remember is these connections happen only when they're doing something. Any activity they are doing, whatever they are using their brain for, there are different chemical changes happening, structural changes happening, and once all this is more structured, then you notice the child doing newer skills. So that is how it happens. That is why we say the only solution is therapy for this. When the child does something, the brain learns. So it is all helping the connections become stronger. And we focus on the kind of activities that will help the child learn, and there are certain techniques in which when it is done, it is more easier for the child with autism to learn. And as I said, each child is different, so it is about finding the right way in which we can teach the children. To be able to connect with them, we need to kind of know these strengths, their likes also. So when we hold on to these strengths and know if they like painting, with the painting, what all other activities or the other person getting involved, making it more elaborate, helping the child. So because the interest, the child is already motivated to do something. And when you're trying to intervene and get the child to kind of modify and learn, so we need to use these strengths and interest to be able to kind of connect with the child to help them learn new skills. So these things are important. The first thing we need to first see is not just the problems the child has, what strengths they have, because that can help us pave the way for the therapy as well. again, it is all about balance when we are trying to work with a child. It doesn't mean that from morning to night therapy has to happen. The child has to be engaged all the time so they don't indulge in other behaviors. Even for us, if somebody is behind us asking us to do one thing after the other, how we feel frustrated, they will also. So research has shown that for more effective outcomes, better outcomes, around 4 to 5 hours of therapy a day is necessary. And again, it's not just in the therapy center. Even while giving them a bath, the way you're splashing or saying words or trying to make them laugh. So much is happening even in the day-to-day routines that can also kind of come into this 4 to 5 hours. And only when you give the space for them to kind of do what they want, their natural creativity and their own thinking and development happens. So it has to be, whatever we do, it has to be a balance. So till 2 years, according to the guidelines, no child should be given a screen. Audio may be okay, but a screen where the child is watching something is not recommended at all, because there are a lot of studies and we have seen that screen time makes this worse. It has an impact on speech, their cognitive ability, behaviors. So that itself can cause symptoms like autism as well. So one is screen time to avoid, the other is the environment. So in the environment they need to get good nutrition, good sleep. So even when we are hungry or when we are not well or not slept, we know how tired we feel and we are not in the capacity to learn or do much, and we are not in the best of our capacity. Just like that, even for these children, if they have not eaten or they have not had good sleep, they will be cranky. So on those days we have to take it light with the children. So we shouldn't force, because then again that can lead to other behaviors and more difficulties. And the other thing is knowing your child and being there, supporting, and you as parents being there just physically is not enough. You need to be mentally there also. So if you're very stressed, you're feeling frustrated that, oh, my child has this, why is things not moving around, and you're feeling too frustrated, that comes out when you're working with your child. So having that equilibrium in you is also very important. These emotions, because we are humans, it comes in, but we need to over time build ways in which we cope. If you are not able to cope with these, there are specialists you can reach out and we can help.